Couples are starting families later in life and their options have increased. Dr. Moshe Perez of Boca Raton Regional Hospital joins us this afternoon to answer your questions about pregnancy options for women who are 40 years old or older. Not too long ago, as we say good afternoon to you,
Good afternoon,
that
Roxanne.
really wasn't put together in the same sentence, 40 years old or older and having a baby, was it?
It seems to be that the stork has been making frequent stops at Hollywood celebrity homes in their 40s, so we have quite a lot of exposure in the literature and popular magazines about older patients.
Well, let's talk odds and statistics, though. After a woman turns 40, what are her chances of conceiving compared to a woman in her 30s?
A woman in her 30s will have about a 25% chance of getting pregnant per cycle. Peak fertility is about age 27. By the time a woman reaches age 40, her chance of getting pregnant per cycle is about 5%.
So now if a woman wants to wait until she's a little bit older to have children, should she consider freezing her eggs?
It's certainly an option. I think that for women who are in their late 20s who are not considering having children until they're in their 40s, certainly egg freezing can maximize their chance of having a biological child at any age.
Now, how does the process work?
Basically, what would happen is a woman will undergo treatment with fertility hormones for about 10 days. And at that point, the eggs will be removed from the ovaries. It takes about 10 minutes to do that. And then the eggs are frozen in the laboratory and kept in liquid nitrogen until they are really needed.
And then IVF, in vitro fertilization.
Yes.
How does that work and what's the success rate with that?
Again, it's age-related. I think for women who are under the age of 35, the chance of getting pregnant from in vitro fertilization is about 40 to 50%. For women age 40 to 42, it's about 20%. And for those women over the age of 43, the chance of success is 5%.
Is there anything women can do if they're a little bit older to improve their chances of conceiving?
There are always considerations in terms of maintaining healthy lifestyle, stop smoking, avoiding unnecessary surgery, and also consideration of donor eggs.
Now, what about women in their 20s and 30s? Is there anything women in those younger age groups can do to prolong their fertility?
I think, again, prevention is really the answer, and that's a very good question. I think the things they can do to protect their fertility is, number one, is don't wait too long, because it may not be as easy later on in life as it is at this time.
Well, that's a very good way to end our segment. Thank you, Dr. Perez. Always nice to see you, and thanks for sharing so much information with us.
My pleasure. Thank you, Roseanne.
Boca Raton Regional Hospital sponsors our expert and also underwrites our Ask the Doctor segment. We're back with more in just a moment.